Yes. Once you are ready, you can start.
Yes, sir. Good evening.
Good evening, nurse.
My name is Smita and I'm one of the registered nurses working in this department. How can I help you today?
Yeah, actually, I am a little bit worried about my father. I am Jessica, and I am talking about my father, Jonathan.
Okay.
He is 81 years old, and he has some kidney problem.
Okay. Okay, Jessica, sorry to hear about your father's condition. I'm so sorry about that. But how can I help you today?
Yeah, I want to know about my father's condition. Can you please explain me, nurse, what are you going to do with him? What does he require now?
Okay. So, as can I see, your father is a chronic kidney patient, and he has kidney failure. Is that right?
Yes, nurse, of course.
And he need dialysis uh, 3 times in a week.
Yeah, of course, you are absolutely
Okay.
right.
So, do you know what is kidney failure is?
I am not sure what exactly it is. Can you please give me a detailed picture of this, nurse, so that I can have a good idea?
Okay, okay, Jessica. Let me tell you what kidney does. So, kidney is an organ which purifies our blood and remove all our toxic products from our body and toxic fluids and extra fluids from our body in order to provide a good healthy condition in our body. So kidney so in your father's case, he has a kidney failure. So his kidney is not working anymore. So in order to purify the blood, he needs dialysis now.
Okay. I want to ask you, I would like to know more about
Okay.
what is involved in dialysis. What is it exactly? And why does my father have to come 3 times a week?
Okay. So as I said, your father's kidney is not working anymore. It cannot purify the blood, and if you'll not if you'll not go for the dialysis, so he can end off with the other disease like blood pressure, swollen ankles, and it can be damage his other organs like heart and like heart and brain. So because our body is producing more toxin and it can be fatal condition. Are you getting my point?
Yeah, of course, that's quite obvious. And okay, will this dialysis improve my father's current medical condition?
Yes, of course it will. But if he will not go for dialysis, then again he will end up with a different kind of disease like breathlessness and heart attack and other his other vital organs may damage. So he has to go for the dialysis. And if he will go for regular dialysis, so he will be fine if he will follow the doctor's medication and regular dialysis. He will be absolutely fine.
Okay, that's good news. But will the dialysis treatment be painful? And will there be any after effects or side effects or ongoing problems because of this dialysis program?
Okay, thank you for your concern. Let me tell you, the dialysis procedure is not at all painful, but yes, during the catheterization, there will be some pain, but don't worry, we'll give you some pain relief medication, so he will not able to feel any pain. And of course, there are some side effects, and there are some like side effects like cramps and muscles ache, and he can get high fever during the dialysis also. But it is manageable. We will monitor him throughout the procedure, and we will treat him according to his sign and symptoms. Are you able to understand my point?
Yes, of course, nurse. That's
Yeah.
quite reasonable.
Yes.
And I want to ask you one last question. My father is currently 81 years old.
Okay.
Then, what could
Okay.
happen were he to decide not to continue his treatment?
Okay, Jessica. As you know that your father's condition is not very good, and unfortunately, his kidney is not working properly. And if he will not go for dialysis in three times in a week, his body will filled up with the toxic materials, and his body might be swollen, his ankle will be swollen, his other organ will be damaged, his blood pressure will be high, and he will end up with the other diseases, and which is again is very bad for him, for his health condition, and he will be poorly. So hope you are understand my point. So he has to go for the dialysis. As you know, his kidney is not working, and he can end up with the different diseases. So hope you're clear with this.
Yeah, of course, nurse. That's absolutely reasonable. Thank you very much for your valuable information. I really appreciate.
Okay, Jessica, and try not to worry about your father's condition. We are here to help you. If you have any queries and doubt, you can call in our number. We will definitely help you. Is that fine to you?
Absolutely. Thanks once again.
Okay, thank you so much.
Okay. So here, how many kidneys anybody has? One or two? Why are you laughing? Tell me, how many kidneys?
Two,
Answer.
sir.
Two. Then you are saying kidney, kidney, kidney. I don't understand. When you said kidney, I was confused really. So kidney is damaged or failed. Means what about the other kidney? I was thinking. So I was doubtful whether a human being has one kidney or two kidneys. I was little bit doubtful. So I wanted to ask you now that it is confirmed. Okay, two kidneys. Then you say one kidney is damaged. Then what about the other kidney then? Is it also damaged, or both are damaged, or only one is damaged? So if one is damaged, the other kidney is working properly, right? Or
Yes,
if
sir.
both are damaged, so what is the purpose of these kidneys? The purpose of these kidneys is to purify, eliminate the waste materials from the body. So if these materials are not eliminated, they will be, dumped in various parts of the body. So they will be um, stored in the body. They are not meant to be in the body. They have to be eliminated. Now, because the kidneys are not functioning properly, the kidneys are not in the fullest capacity, or they have been incapacitated, or their power is becoming weak. So now there are two ways. Now the kidneys cannot be repaired. They cannot be brought back to normalcy. So now what are the possible options? There are possible two options. The kidneys must be replaced. Okay, we have to get kidneys from somebody else, from donors, and to replace them. Otherwise, children, we have to substitute with artificial mechanisms, particularly dialysis machine. So it cannot be continuous, but it can be continual. That means thrice weekly and regularly. Continuous means without any stop. Continually means one day you do, another day take rest, another day you do, another day. So continually. Continuously means kidneys work continuously, but dialysis cannot be continuously used. That's the point. So maybe for 1 hour or 2 hours you will put, and you'll eliminate all the waste materials till then, and you will send him back home. Then again he has to come alternate days, so times a week we can say. Right. So this is the way how you can speak. So the quality, improve the quality. The quality is compromised. The quality is compromised. Every time you are saying your body parts will be damaged, your kidney will damage, your heart will damage, everything will damage. You are scaring me actually. My father is going to have dialysis and I'm already afraid, and you're making me still more worse. You're worsening the condition, my condition. You're making me more scared. Oh my God. Heart damaged, kidney damaged, liver damaged, and all the body will damage. So instead of that one, you can say all the body parts will function effectively. This dialysis treatment, okay, will clean the waste materials from the body, unwanted materials, because the normal process of cleaning is not happening anymore. So we use dialysis machine to eliminate the waste materials. Otherwise, they will be deposited in various locations of the human body, and this results in many complications which are unwanted. We don't want these complications to arise in the future. So for this purpose, dialysis is very important. If you do not take this dialysis, then the condition may deteriorate further, or worsening of the conditions. And if serious, it will lead to disastrous situations and death also. And God forbid, these situations will not occur in any human being. So for that purpose, we recommend a dialysis. So this is the way how you can speak. Is that clear? Yeah. So where is this girl? Smita. Is that clear,
Yes,
Smita?
sir. Yes, sir.
Huh?
Yes, sir.
Right. So improve the quality of sentences. Okay. Don't speak just like a school children. You are talking very nicely. You have a lot of information, but how well you can produce that one is important. How well you can, you cooked everything, but you have to decorate it in the paper plate. Otherwise, it will not look pleasant. So that's called presentation. Right. So that's
Okay,
fine.
sir. Thank you.
You will not throw everything in your plate and give it to your husband or son, right? You
Yes,
nicely
sir.
decorate in small bowls and put there, right?
Yes, sir.
Uh, you'll arrange in one plate, one side rice, one side this one side that one side like this one. So that's it.